I was shown some e-learning materials produced by the BMJ by a colleague who works as a cancer nurse, and it was really unengaging. It was very flat, it was pure text. Because you were sitting down to early signs of cancer, you were pump primed as to what it was. And so as a radiographer, which I am, it was easy just to pass it without giving it any thought. So I was thinking, well, why not try and simulate a GP surgery, have a focus on early signs of cancer, but actually throw a few placebos in as well, so the outcome's not a foregone conclusion. So we developed a mock-up, took it to the local cancer network services. They were impressed with that, and we therefore developed a pilot from there.
Thanks, Doc. Good to see you too.
The idea is to provide multiple media that the doctor can engage with, so getting away from that pure flat two-dimensional text-based learning. So you've got the talking avatar to represent the patient. You can tap into an open files which replicate patient notes, so if you want to have a look at previous history you can. That some of the cases have got test reports on there, so it might be x-rays, it might be blood tests. So all the sort of stuff and information that a GP would have available where you and I'd go and sit in front of them and say, I've got a problem, effectively we've reproduced within this tool so that they can access those things to help their decision making.
Look, I don't want to take up too much of your time, but it's the old back playing up again. I was hoping for some stronger painkillers, if that's okay.
So let's take the middle option here. So you just say, how's life on the farm?
So to be honest. It's a tough world out there now with all the big supermarkets squeezing us for every penny.
And again, you've given some options on how that conversation would then develop, and you choose and off you go. So if we keep in with the middle one, you would then respond by saying, sorry to hear that, Mr. Huxtable, tell me more about your back pain, where's it hurting?
Oh, it's really playing me up at the moment. Right in the middle of my back. Oh, right there. Look, you must remember, I was on the computer, I had back pain a few years ago.
So, and that's how it's done. You have the conversation, it runs for 10 minutes or so. The idea is to get the message across that these resources are available in terms of risk assessment tools and when you should be 2-week rate referring and things. And I think GPs like it. We've got a very good animator working in the office just down the corridor, and this is done using a real actor, as one of my colleagues, and it's an Xbox Kinect, so the thing that detects real motion. And what it's done is it's mapped to features on her face, and then as you see when the video plays out, what happens is it's transferred across to a model.
Ben's really sedated. I can't seem to rouse him. What meds did you give him?
Well, I gave him PRN lorazepam. Yeah, it's prescribed by the doctor, so I just gave what the doctor had prescribed him.
So that's then mapped into an avatar.
Yeah, of course I did. I did check that. I mean, the ward was really busy, but I wouldn't have given him his meds unless I'd actually checked that he'd had his regular dose. Yeah, no, I definitely checked his regular dose, and he told me he hadn't had it.
And that's an example of how we do that, and that will then end up as a video clip which we can import into the player and run it as you've seen in the scenarios. We're in conversation with the Royal College of GPs to get it hosted on their website, but also we have interest from Macmillan, who are sort of looking to take this work forward. So we're trying to find a platform that actually will continue with the work, because certainly the feeling from the Cancer Network and ourselves is that the data we've got back in from the evaluation is that it's a good thing, it's fun to do, it's a relatively short piece of work, but is actually useful to practice. So it's a question of trying to find somewhere to take it forward and sit so that as many GPs as possible get to see it and use it.